So
Okay, good
what's going on?
morning, and I'm glad to be here. Glad to be here with my dear brother Bode Oshosami, who I haven't seen in a while. I am visiting from Lagos, where, as many of you might be aware, I practice as a doctor. I, as a doctor, particularly specializing in nephrology, which is the care of patients with kidney issues. This has become quite a major problem in the last couple of years, as there's been almost like an epidemic of individuals developing kidney failure. And why has this happened? It's happened on account of the fact that the conditions that lead on to kidney failure are becoming more common in our environment. Our capacity to be able to establish the diagnosis has improved, and we also believe that the change in lifestyle has also influenced the increase in numbers. And lastly, of course, the challenges of the current economic crisis in the country has also made it a challenge for individuals, even when diagnosis is established, to be able to properly and adequately manage those conditions. So, what are the common conditions that we see in our environment that can lead on to kidney issues? Hypertension. Hypertension is common. Easily 50-60% of individuals over the age of 50-60 would have hypertension. Very few of them would be aware that they have hypertension, and even fewer would properly manage the hypertension. In a lot of instances, because they can't afford the costs of even the simple antihypertensive medications. Diabetes is also becoming more common because we're becoming quite sedentary in our way of life. We are also, unlike in the past, we tend more towards fast foods these days. This has made us increasingly more obese, and then we don't exercise as much as we might have done in the past. All of this has ensured that the prevalence of diabetes has increased from about 2% 30 years ago to about 8% now in the general public in Nigeria. And as with hypertension, only 50% of those who have diabetes are aware that they have it, and only 50% of those who are aware are managing it properly. So you find those two conditions on their own are responsible for quite a significant number of people who develop kidney failure. The third is what we call chronic glomerulonephritis, and this is an aftermath of many chronic infections that occur in our environment that are not properly diagnosed, and even when diagnosed, properly managed. So simple things like malaria, if you don't manage it, particularly the Plasmodium malaria type. Things like hepatitis, like hepatitis B, hepatitis C viral infections, HIV. All these are things that cause chronic infections in the body, and being not properly recognized nor managed lead on to kidney failure at the end of the day. So these three conditions clearly are the three commonest reasons why people develop kidney failure, but there are quite a number of others. Sickle cell disease, patients are surviving beyond infancy, and kidney failure is one of the things that can emanate from it subsequently. There are inherited conditions apart from sickle cell, like polycystic kidney disease, which also worldwide contributes almost 10% in terms of numbers of individuals with kidney failure. And then, of course, abuse of common medications, even your simple analgesics. If you abuse them, can lead on to kidney failure. Agbo and other agumo and other native medications. And of course, the use of skin lightening creams that contain heavy metals like mercury. These are some of the reasons why people develop kidney failure. But one other factor which one must stress is the fact that as people of African origin, we're 4 times more likely to develop kidney failure than individuals of any other ethnic group, particularly the Caucasians. And we have now coned down the reason for this to the inheritance of a gene known as the apolipoprotein 1 gene. And that apolipoprotein 1 gene is particularly prevalent in the West African coast of Africa. Now, if you inherit it, the chances that if you develop a condition that potentially can affect the kidney, the likelihood of your now developing kidney failure is about 4 times more likely. So if you inherit the apolipoprotein 1 gene and you have hypertension, diabetes, HIV, all these are things that can and very often lead on to kidney failure. So you find that if you draw a heat map of the prevalence of kidney failure in Africa, you'll find that in North Africa, in the Maghreb region, about 4% of individuals have kidney failure. In South Africa, it's about 12%. In East Africa, it's about 11%. In Central Africa, it's about 16%. In West Africa, it's about 16.5% of people who are known to have various stages of chronic kidney disease in that environment. This apolipoprotein 1 gene is an inherited gene that we believe initially was protective for individuals who developed trypanosomiasis. That's the sleeping sickness. Now, trypanosomiasis is no longer an illness, but the vestiges of the inheritance of that gene make you more prone to kidney failure if you inherit it. So these are some of the reasons why we feel there's a pandemic, a looming epidemic of kidney failure in Africa, particularly in our dear country, Nigeria. Thank you.